I'm Melissa Colman, a women's health nurse practitioner at IU Health Southern Indiana Physicians, and I've been in practice since 2010. I always knew I was going to be in the medical field since I was a little girl, but when I was in college I started volunteering at Middleway House, our domestic violence shelter in town. And it was my work with the sexual assault advocates that really made me want to become a women's health nurse practitioner. As a nurse practitioner, I just feel like I get a little bit more time with the patients and sometimes a little bit more of a holistic approach as well, which I really love. So on your first visit coming in to see me, I will come into the exam room first while you're fully dressed, and we'll have a long discussion first going over your past medical history, family history, and definitely any questions or concerns that you have that day. I always try and make sure I ask that question multiple times during a visit because it seems like people kind of remember things as the visit goes along. Then afterwards, I'll step out of the room and let you get undressed if we're doing a full annual exam and you're over 21. You know, I get a lot of people ask, oh, I'm only 20, do I have to have a pelvic exam? And the answer to that generally is no, unless you're having some type of problem. So that always kind of reassures people a little bit. If it's your very first exam, I'll make sure that I go over exactly what I'll be doing ahead of time and showing you all the instruments that I'll be using as well. Then afterwards, we'll do the head to toe exam. I'll step out of the room to let you get dressed once more and then pop in again just to make sure that everything's good and you don't have any further questions. So I love my job on so many different levels. One is absolutely getting to help the patients. You know, whether it's just a screening visit, lots of reassurance, making people feel like they're very on top of their health is always a wonderful thing. But especially the problem-focused visit. People come in with a lot of fears sometimes, and it's really nice being able to talk people through all the steps that we're going to do to figure out what's going on with them and making sure that we both feel comfortable with the plan of care. Then, of course, I love my coworkers. They make every day a joy, and it's wonderful to have that culture on a day-to-day basis. On my day off, I get to babysit my nephew, which is always a joy to be around. And I love traveling with my husband, playing with my dog Peter, and reading.